Great to be joined here on The Colour of Country Life by the member for Mallee, also the Shadow Assistant Minister for Regional Health, Anne Webster. How are you, Anne?
Very good, thank you, Ricky. How are you?
I'm great, thanks. Look, I imagine you're recovering from a massive regional health summit that you staged in Mildura. I've seen the video on your social media. It looks like a big turnout and some important messages shared there.
Incredibly. I couldn't have hoped for a better outcome. The people that were in the room, all of the regional health workforce themselves, doctors, nurses, many doctors, nurses, allied health, practice managers. We had 4 or 5 universities present, so we could really get into the nitty-gritty of the issues that regional health, the failure in regional health at this point in time is undergirded on. And so, look, I am really thrilled. Dr. Nick Coatsworth, of course, did a fantastic job facilitating. And we arrived at an agreed preliminary summary, and that was sent to Professor Brendan Murphy and also to the National Rural Health Commissioner, Ruth Stewart. I've also sent it to the Minister, Mark Butler, and Emma McBride, the Assistant Minister. So,
Brendan Murphy, you mentioned there, he's the Chief Medical Officer, is that right?
No, he's the DepSec for Department of Health now.
I see, sorry. I did speak with Ruth Stewart, the National Rural Health Commissioner, who said she sent something through by way of a statement but couldn't get to the summit. One comment that is raised in the promotional video, which is quite worth seeing on your Facebook page, an individual saying that having a doctor, it doesn't have to always be about a doctor providing the service, if I can paraphrase. That was partly what we talked about with Dr. Ruth Stewart, was that the multidisciplinary model could be a way forward in regional health.
Absolutely. It is certainly one of the pillars and one of the discussion points, as you say, that was raised. What I think impressed me about the summit was that even though people came with varied viewpoints, varied backgrounds, strong positions, you don't get a room full of presidents and CEOs of health organisations who generally don't see eye to eye, collaborating on solutions very often. I think that was one of the key wins of the summit. And it was not political. People, wondered whether it was going to be political. I made it very clear right from the get-go. This is not a political stunt. It's not a political event. This is about regional healthcare. And we stayed on task and on topic. And, we're calling for things like the regulatory frameworks that AHPRA, the Australian Health Practitioner Regulatory Agency, manage, which are currently such a barrier to access to care in the regions. That needs to be looked at. The immigration, registration and examination processes that they control for international medical graduates, and they need to be streamlined, and they absolutely need to be more affordable and supported. And international nursing and allied health should be part of that. So that's just one area. Everybody in the room agreed on the expansion of the distribution priority areas as a very bad idea. It has had an immediate and a negative impact on general practitioner distribution in rural and regional Australia. And we're calling for it to be reversed as a matter of priority. So there are a few more summary points that we workshopped at the end of the conference, at the end of the summit, and agreed with those principles going forward. So it certainly gives us the basis. Before we went into the summit, I'd done a survey with Mallee regional residents. 2,000 people responded to that with regard to their own healthcare. So that gave us the basis for many of the issues and the questions that we discussed. This now, I have a digital platform with everything that was said at the summit, which is a massive amount of work, but I now need to do a collation of and thematic analysis, look at the issues as they distill down, and then, of course, to results that we want to form into solutions.
Now, we're speaking with Anne Webster, the Shadow Assistant Minister for Regional Health. Now, this summit, you say it wasn't political. I gather that's a reason it didn't happen in Canberra, and you staged it in Mildura, somewhat close to really, 3 states, at least if not more, that are affected by regional health shortages.
Absolutely. It was incredibly important to me. I made it very clear to the peak bodies, actually. We're talking the Royal Australian College of General Practitioners or the Australian College of Rural and Remote Medicine or the Rural Doctors Association or the National Rural Health Association, all of these bodies plus many, many more. I said to them, I want you to hear from those on the ground. This is not about data collection. This is not about, what the academics tell you from the work that they do. This is about real voices who are living in the communities, what works, what does not work, and why the health system is failing in regional Australia. And then I want you to respond to those voices. So they knew that it was actually upside down, and the comments following the summit have been that it was like no other conference event. Normally you have the panels get up and, the experts tell everybody in the room what a wonderful job they're doing, and they probably are, but this was for grassroots practitioners to be able to tell the story and to make their views known. So, look, I was thrilled with the summit, and people are calling for another one, but it was a lot of work.
It's a 2-day summit, wasn't it? And it sounds like it ran in a more sort of bottom-up or Q&A style format rather than a top-down sort of lecture arrangement.
Yeah, absolutely.
Now, Anne Webster, we also talked about recently on Flow, you talked about these medical bodies and presidents and whatever else that might not necessarily see eye to eye. Was it discussed with the role that they actually play as professional organisations? Sometimes they can be a bit of a blocker in terms of getting someone into the country because of accreditation or other standards. Was there an agreement maybe those standards need to be reviewed so we can smooth the path, say, for people like from an island, for instance, the nation of Ireland, that are pretty close to ourselves in terms of how we run our medical accreditation? They could come in a bit easier?
Yeah, look, there was definitely they don't have control of that, of course. AHPRA do, and that was the point about calling on AHPRA to streamline their processes, to make it less expensive. The fact is that Australia is actually competing with Canada, with New Zealand, with other countries for those Irish and English, the UK doctors who are leaving the country. We're competing with New Zealand and Canada, and New Zealand and Canada have streamlined their processes. It's less expensive. It is easier, in other words, for those doctors to go there rather than here. That's just got to stop. Australia has got to step up and make the changes that need to be made so that we are at least providing a competitive market for these doctors to come in.
All right, we would need to move on to another topic that I know you're very passionate about, particularly for the people in the Robinvale area when it comes to their local banking services. The no, it's not a Royal Commission, is it? Not yet. It was a Senate inquiry that occurred down in Sale, Victoria. Is there likely to be another hearing somewhere in your neighbourhood to talk about the impact bank branch closures are having there?
Look, I've raised again with Matt Canavan, who is on the Senate inquiry committee, that I would want him to come and bring the inquiry public hearing to Robinvale to meet with the people in Robinvale. I said it to him again yesterday. He is, of course, trying to be fair to all states and territories and give everybody a go, but I have raised it with him again and asked that he bring the public hearing to Mallee.
Yeah, I imagine what they hear in Gippsland's a bit different to what you hear up in the northwest of the state, where you're a lot further from Melbourne.
Yeah, absolutely. Absolutely true. And, it's much the same in terms of the health workforce. In regional communities, it is a very different story to an urban setting. And regional communities do it tough, according to the AHPRA. We miss out on $4 billion worth of healthcare in the regions. Now, I've yet to investigate that to really find where all of that sits. But if that is true, it is an absolute disgrace.
Yeah, that's got to be quantified somehow. You're in Canberra for parliamentary sittings, and I know you've caught up with the parliamentary friends of trucks, trailers, transport and logistics. Scott's refrigerated transport fell over recently, which has been amongst the talking points in national politics. What are some of the stresses on the trucking industry you heard at that forum?
Look, when I spoke to the truckies last night, I spoke with Sam's trucking business from Western Australia. He's got I don't know how many trucks, I didn't check it out, but a lot. And he said that the big issues for the trucking companies are workforce. And the problem is that there is little accreditation. You know, we see the trainee truckies going out with their loads of cement on the back, but there's little training. So you can get very young people taking on trucking and not necessarily the experience. I mean, he particularly spoke to me about the comparison with flying a plane that it takes 3 years and multiple exams and, so forth. But we would no more give a pilot 2 weeks to get a license and fly a plane than we would, and we shouldn't be saying that it's okay for truckies just to go out and do a 2-week training. That's true. On the other hand, as I said to him, if you make it very complex to get a trucking licence, are you going to get less drivers? Because the reality is that is their biggest issue.
They almost need a special training on how to handle dilapidated roads in your electorate as well. Truckies have got a lot to manage with a heavy load on some pretty bumpy roads.
Absolutely, and you've got to, those big triples that I drive behind through Mallee, they don't stop quickly, and people drive, and this was one of the other comments made at the trucking forum last night, was that people in cars drive as though a truck can stop in the same time that a car can, and they just can't. So, I think general education was what was being called for so that everybody would know how to manage with trucks on the road. And, obviously there are issues around the fuel tax that's now being considered and just making small mum and dad family businesses viable into the future. We just don't need any more Scots, falling off the perch.
Yeah, absolutely. And certainly that road safety message, one we keep sharing when we can, about being mindful when you're driving around trucks and their heavy loads. Anne Webster, a lot on the agenda over in Canberra, the member for Mallee and Assistant Shadow Minister for Regional Health. Thanks so much for joining us today.
Absolute pleasure. Thanks, Ricky. Have a good day.